Good afternoon. I'm Donna Gonzalez from CVIA, and I'd like to welcome you to the 2015 Medicare Advantage Group Awareness Training to CVIA brokers. First, thanks go out to our sponsor, Connecticut, and to our presenter, David Pilata, who is Connecticut's Medicare Group Specialist. Today's webinar should last approximately 30 minutes, depending on the number of questions that you guys have to ask. And at any point during the webinar, you may submit questions by entering them into the Q&A box on the lower right-hand side. Please do not use the chat box. After the presentation concludes, we'll open it up to the Q&As where we will address any of the questions that we have received. Also, the recording of this webinar will be available on the CVI website probably early next week in case others in your office could benefit from the information. So without further ado, I will turn it over to David.
Thank you very much, Donna, and good afternoon. Thank you, CVA, for allowing Connecticut to be part of your plan offerings again for 2015. This is the Medicare Advantage Group Awareness Training for the 2015 year, and is one that is required in order to be able to sell our product on the CVI website. So I thank you very much, and without further ado, we'll get started. I, again, am the presenter and the Medicare Group Specialist for Connecticut, and point of contact for CVIA with this relationship. We're going to touch on the plan itself, Group Medicare Advantage, and the changes that take place to the plan for 2015. We'll also talk about enrollment, both how-to and information that the members will receive, how those members can receive services through our Member Services Department, important reminders, and then we'll finish up with Q&A. So on to the plan itself. Very little change has taken place from the 2014 plan year into 2015. The first, obviously, was a change in the premium. There was a 5% renewal for the CVIA plan itself, which is bringing up the monthly per member per month premium to $356.95. Again, this plan is available to all CVIA membership that is obviously of Medicare eligibility. It breaks down into two different classes or two different groups. There's employer groups with 20 or more full-time employees, and then there's employers with less than 20, 19 and under full-time employees. So starting with the 20 and over, our product is available to retirees of those companies or people, full-time employees that do not, I guess they wouldn't be full-time employees, but part-time employees that do not earn enough hours per month in order to be able to receive benefits. So if someone is only working part-time, granted they have to be an employee of the company, not a 1099, but an employee of the company, we are able to put those folks onto the plan. The other group is the 19 and under. With this, as Medicare states, when a group has 19 or fewer full-time employees, anyone that is of Medicare eligibility, Medicare is primary for those people. Because of this, we are able to include on our Medicare Advantage plan any actively working aged Medicare beneficiary. So someone that's 65 or older that is eligible for Medicare would be able to come onto our plan even when they are a full-time employee. So obviously it's also available to any retirees of that company, but we would be able to put that on for the active working individual as well. Again, this is a point-of-service plan, and a point-of-service plan is one that does allow for both in- and out-of-network benefits. When you look at our summary of benefits, you'll notice that there's really only one column. This is the reason because we duplicate or mirror our benefits both in and out of network. This allows for our plan to be able to be utilized throughout the country. A member does not have to live in Connecticut. With this plan design, It's a nationally filed plan, different from our individual product. So this does allow for someone to live outside of the area or even a snowbird and be able to access our plan. Because of the Medicare Advantage plan and its nature, that particular plan becomes primary. So when a Medicare Advantage plan is in place, Medicare is no longer primary. The individual still needs to be participating in both Parts A and B of Medicare. But then Medicare, in this case, is responsible and takes over all of the claim services for that individual. So if you're seeking benefits from a provider outside of our network, the requirement is that you need to make sure that that provider is a Medicare-approved provider, and we're going to pay that provider at 100% of what Medicare would allow, less any copay or co-insurance that may exist within the plan design itself. But that provider will receive 100% of that benefit. They just need to send in a claim to Medicare instead of sending a claim into Medicare, because we're responsible for that. Within our plan, we also have a built-in protection that is for the max out-of-pocket portion. This is $3,400. So once an individual accumulates $3,400, and that is made up of copays or co-insurance for medical services, not prescription. Prescription does not count towards the max out-of-pocket. Just medical services. Once $3,400 is reached in a calendar year, then all services, medical services, will be covered in full from that point on. We also provide worldwide coverage for both emergency and urgent care, and that does provide us with a $50,000 annual maximum on that. Again, there's a 3% commission built into this plan for brokers based off of the $356.95 per member per month premium. The plan is effective on January 1, but do keep in mind that we are able to write what we refer to as age-ins, or people that are becoming eligible for Medicare during the year, to be able to come on the first of the month whenever their Medicare eligibility is effective. So that could be for January 1. It could be for March, April. The important thing to remember is that when you're completing the application or having a member complete the application, to make sure that it is dated and signed prior to the effective date. We cannot retro-enroll someone. The application must be signed prior to the effective date. And once again, with great honors, Medicare has received a 4-star out of 5 rating from CMS for the health plan quality. This now makes 4 years in a row that we have been a 4-star or better health plan. This is ultimately something that is very meaningful. It's similar to the Consumer Reports, and Consumer Reports rates products. Well, CMS rates health plans, both prescription drug only as well as Medicare Advantage, and it's comprised of about 60 different criteria, everything from the plan design itself, customer service statistics, appeals and grievances, follow-up, the providers themselves, and how well providers are doing preventive services, how well they're following up with post-surgical type of procedures. So about 50 of these different criteria are made up of the star rating, and ultimately we are able to receive more money from CMS to help manage the care for the members that we have on our plan because we are better than, or at least a 4-star rating. So that is a huge achievement for ourselves. The additional plan highlights here focus more on the prescription drug portion. And as I said, this did change slightly from 2014 into 2015. Currently, the plan is a 4-tier drug plan. It's an open formulary, meaning that any drug is available. You just pay at the highest copay if it's not on our formulary. But then it is an open formulary, and it is 4-tier. Tier 1 being generic. Tier 2 being preferred brand. Tier 3, non-preferred brand. Tier 4 is specialty. These are infusion type medications and such that are typically administered in a provider hospital setting. The way the change is taking place for 2015 is that we're taking the initial Tier 1 category and we're breaking that into two categories. So instead of just generic, there's now going to be a preferred generic and a non-preferred generic. That's as simple as that. We're keeping the copay for each of those tiers the same. So the impact that this results on for the member, there is no change. So where they were paying their copay last year, they're paying the same amount whether it's a Tier 1 or 2, as long as that was a Tier 1 last year. The other stipulation that we need to address is that CMS does not want our brokerage community to call our network, which is a network for Express Scripts, and it has two networks within the network. There's a preferred side, and last year what we were calling a non-preferred side. For 2015, we need to call that a standard side. CMS does not want us using the word non-preferred. So we have our preferred and our standard. They're all within the network. The two major pharmacies that are in the standard side would be CVS and Walgreens. On the preferred side, we have Rite Aid, Stop and Shop, ShopRite, Target, Costco, Walmart, Beacon Pharmacy, Lupe's is in there. So it's a very extensive list, and one that is available within the directory. But there is a differential in the pricing of the prescription where someone can save additional money by using the preferred over the standard, but they can access the entire 60,000 plus national network from Express Scripts. A plan is still an open access plan, which means that there's no referrals. You're able to go directly to specialists. This has been something that people have screened for since HMOs have been in place. So we understand the importance of that, and frankly, there's not a lot of cost savings that are associated with directing people to a gatekeeper, so we give them the access to be able to see that referrals. There are some prior authorizations which are required on the plan. Those are typically handled by the provider or the facility that the individual is utilizing. There are additional things. So first and foremost, the Medicare Advantage plan has to cover everything that Medicare does. So there's no loss of coverage as you're on a Medicare Advantage plan. It's really, frankly, quite the opposite, where there's additional things that are included in above and beyond what original Medicare. Comprehensive physical exam is one of the major ones, where Medicare finally does now provide an annual wellness exam. It is not a comprehensive full annual physical. When you go to the doctor, they make sure that you're check on you for some simple vital signs. But beyond that, it doesn't include much. It doesn't include lab work, the blood workup, those types of things, cardiovascular. So a comprehensive annual physical, which we do cover at no cost, as we do for all preventive services, is really above and beyond what Medicare or supplements cover. Silver Sneakers is a program that is, again, included in the plan. We found this to be a great benefit, both from a physical standpoint, but also mental and social for the seniors. They seem to enjoy this program very much. We just found out this past week that LA Fitness is also now included into that network. What this does is it provides a standard membership to the individual that presents the card. Silver Sneakers is more of a brand and a logo, and then they associate with LA Fitness, Curves, Health Tracks, the YMCA, and then that extends then to the individual that has a membership to go there. They're also reciprocal. So this person that may be a snowbird that's traveling down to North Carolina or Arizona for 2 to 4 months out of the year, they can access the facility there because it is a national network. They've got over 12,000 facilities. Vision discount program is not a benefit, but really just a discount program. We certainly do cover for routine eye exams as well as hearing exams, kind of above and beyond Medicare. But this is a discount program which provides 25 to 30% off of frames, lenses, contracts that could be prescription or not. So we have participating providers which are listed within our directory, and you'll be able to receive additional discounts off the retail cost of those. And our touch points, our Connecticut touch points, this is where we're very, very proactive, as opposed to Medicare, which is more reactive. So we have case managers to help people with cancer, heart disease, diabetes, to be able to understand their illness better, be able to provide treatment options to them, be able to provide them with health reminders. Somebody with diabetes is very important for them to continue to see the optometrist and the podiatrist. So we make sure that those things are being done, but also allow someone to have a quarterback, essentially, to be able to help manage their case specifically for them with all of the different specialists they may have tied in with that. So, again, it's something that's there to help members better understand their illness, better manage it, and to live a healthier and longer life. The medical plan itself, we'll deep dive into this. This, again, is just a snapshot of a few of the benefits that are there, the summary of benefits, which is accessible on the CBIA website, is more detailed and specific to the individual benefits if there's something that's not seen here. Again, the premium we've touched on, the max out-of-pocket we've touched on. The annual physicals, as I said, is no cost, as well as all of the other preventive services, such as bone mass, cervical cancer screening, prostate. The list goes on for all of those types of services. You also have coverage for, of course, vaccination for your flu, shingles, those types of things. Primary care office visit, and there's no changes to any of the dollar amounts of the other items from the way the plan is today. $15 for your office visit, $30 for a specialist. As I said, hearing, routine hearing and vision exams are covered. Medicare does not cover for hearing exams. With the vision exam, there is one caveat that we do not provide the coverage for the refraction portion of a vision exam. It's not something that has to be done. What we're providing the service for is to check for illness or injury. The refraction portion really provides a prescription to allow that person to get glasses. So where that typically costs somewhere between $40 and $50, unfortunately that's not something that we cover, nor does Medicare. A big difference here, lab and x-ray services, diagnostic radiology, therapeutic radiology, and ambulance. These are all at $0. Some of the questions that typically will come up and we'll address towards the end, but how does this differ from your individual plan? I think this is an area of that truly highlights a significant difference between what our individual plans are versus the CBIA plan, which is unique to the industry. Outpatient surgery can be had at both ambulatory surgical center as well as a hospital. There's a difference in cost there, less at the surgery center versus the hospital, but it's $200 or $300. Inpatient hospital days, 1 to 7, this is on a per diem basis, is $250 per day. Beyond day 7, there's no additional cost that is involved for this plan. As I said, the prescription drug plan here, you can see better the illustration referencing the 5 tiers. Where you see tiers 1 and 2 are the preferred and non-preferred generic. This also illustrates the difference between our preferred and standard network within Express Scripts. So we have everything in network within Express Scripts, and then about half of it is preferred, and the other half obviously is under the standard. There is a $5 differential for the copays in each. 90-day retail supply can be received at a local pharmacy. These are shown in our website under our directory that they will accept a 90-day supply. It is 3 copays, so there's no savings there. The savings is really directed to steer someone towards the mail order. The mail order does go for essentially $2 2 copays on tiers 1 and 2, and then it's about 2.5 times for the mail order for the tiers 3, 4, and 5. Again, this plan provides full coverage through the gap or the donut hole. So once a member hits $4,700, they enter into stage 2 of the prescription drug plan. The initial stage is the initial coverage limit. That runs from $0, retail $0, to $2,960. So from $2,961 all the way up to $4,700 is what's referred to as the donut hole. So where this plan does have a donut hole underlying it, there's secondary coverage or wrap coverage, which is put on top of the donut hole. So what it allows the member to do is continue to pay copay even on the preferred drugs right through the coverage gap until they hit that point of 4701, then puts them into the catastrophic phase. And at the catastrophic phase, they go to $2.65 for generics, or $6.60 for brand, or 5%, whichever is greater. Okay? Our network is comprised of over 27,000 fully accredited, credentialed providers with a very high rate of board certified within that. It is a slightly different network than what you see out there on a commercial product. So do reference our website when quoting whether or not a provider is in. We do have an extensive network. It is across the entire state, all 8 counties. We have every hospital except for the Children's Hospital up in Hartford. The point of service plan, as I had mentioned earlier, does provide the flexibility for people to see and seek services from Medicare-approved providers outside of the network. Again, that provider needs to be able to submit the claim into us at Medicare. They need to be an approved provider, Medicare-approved provider, and we're going to pay, in combination with whatever copay they may have, 100% of what Medicare would allow. So there's no reason why that provider would not want to see you, or see your member. Outside of our theater network here in Connecticut, we have Westerly, Rhode Island, some Springfield, Massachusetts providers, as well as the West Hartford area. Westchester, White Plains are some of the other areas that we have some provider network in. A lot of it's crossover. For the most part, it's a Connecticut-based network. Excuse me one second. Sorry about that. Our provider directory is available at connecticut.com/Medicare. When you're going to access this, keep in mind that this website also encompasses our individual products, and on there you'll see our individual plans. The network itself is the same, and the provider directory is the same. So you can certainly utilize that to find doctors, hospitals, labs, participating opti centers for discounts, all of those fun things. So you can absolutely utilize that. But do keep in mind that there's a lot of individual information on there which is different than what can be accessed by going onto the CBIA's website, where we will post all of CBIA's specialized plans, summary of benefits, the formulary. So CBIA does provide all of that information to you as well. And I think we touched base on our national pharmacy network. Again, some of those preferred networks: Rite Aid, Walmart, Target, Costco, Stop and Shop, Beacon. There's quite a few others as well. So that's certainly something to be also searchable on our directory. As far as enrollment is concerned, the pre-enrollment is going to allow the individual to receive a pre-enrollment letter. This letter is really one that is included on, again, CBI's website, the enrollment form on the website, summary of benefit, access to the formulary and directory is all going to be accessible to the CBI website, as you see at the bottom of the page, cbi.com/Medicare. Eligible applicants must complete the enrollment form, as I said, absolutely required to sign and date prior to the effective date. The applicant either sends it to you, the broker then submit that into CBIA. Again, all applications must be signed no later than December 31st, 2014 for a January 1 effective date. If we're talking a July effective date, a July 1 effective date of 2015, it needs to be signed prior to that. CBI is going to receive your applications. They're going to enter those into the enrollment system. They then send that electronic file over to Medicare. Once we receive that, we send it in to CMS, Center for Medicare Medicaid Services. They will then verify that each and every applicant has, in fact, eligible and enrolled in both Parts A and B, since they need to be on those plans in order to be able to join our plan. Once we receive that information back, the process continues. So the post-enrollment materials, so once we receive the feed from CBIA, we send out a letter to the beneficiary saying, it's a welcome letter, we've received your application, it's in the midst of being processed. Once we get the word back from CMS that this person is good to enroll, we will then get started on developing the ID card, providing the evidence of coverage, a summary of benefits, a directory if they're so inclined to choose one, as well as a formulary. So these things will all be mailed out to the individual. Typically, we look at a 2-week turnaround time. So from the time that we get the application, we look to see about 2 weeks to turn that around in order for the individual to have their ID card in hand. Okay, so just keep that in mind as the end of the year is approaching. That December 1st would be a nice time. December 15th is certainly pushing the limits to have a card in hand by the first of the year. But you can always go right up to the very end and still get that individual enrolled. Just keep in mind they won't have their ID card right off the bat. Communications after the enrollment, as I said, that acknowledgement letter is the first piece that goes out. Then we're going to send a notice of confirmation of enrollment that we've gotten the CMS approval back. We put together the member ID card. It's both medical and prescription on the same ID card. And the Medicare insurance card, the red, white, and blue HIC card, does not need to be used or shown once the individual is on our plan. Again, they need to keep it. They need to hold on to it. I've heard people say, I can destroy this now. No, you don't want to destroy it. You want to put it in a safe place, safe deposit box, but make sure it's accessible. And that you do need to continue to pay for both Part A and B in order to maintain the coverage with Medicare. The welcome kit is also going to receive health risk call. This is something that is done. It lines itself back to the star rating that I had talked about, and us being able to make sure that we're receiving the appropriate amount of money from the government in order to maintain the health for each and every individual. So the health risk call is one that it's voluntary, but we certainly urge you to going to happen, and if they can participate in it, it's very helpful for us to gather information to be able to then relay back to Medicare. And then, in turn, this allows us to be able to make sure that we're getting the appropriate amount of money based on the health conditions of the individual. If need be, they can do even a further and more detailed in-home health assessment. We also have a premium assistance call. This is to help identify individuals who may qualify for additional assistance, the extra help program, the LIS, or the low income subsidy, Medicare savings. It's important that you let your member know that this is going to happen. It's probably the most alarming call that they get, because ultimately people are asking for some pretty detailed information, and it's certainly something that they've been the seniors have been told not to give out. So they don't have to do it, obviously. There are websites that are available. The Department of Social Services has the Medicare Savings Program pamphlet and application. That's right there, which is a income-based program, and incredibly helpful for someone that earns under a specific amount of money. It's about $2,400 a month in pure income. It does not look at assets. Could be something that would be helpful for them to be able to investigate. It ultimately helps save and pays for their Part B premium. It's $104.90. So certainly something that's worth discussing with your clientele. Member services is accessible 12 hours a day, from 8 to 8, 7 days a week. This is very helpful. They have all of the information that is posted on CBIA's website. A member can call up there, ask about their benefits, ask about a doctor in the network, ask about medications, anything that they need to. Very useful website. So please make sure that this is something obviously on their ID card itself, but by all means make sure that they utilize that, because they are a recorded line, provide necessary information, and should be able to address any concerns that the individual might have. And just to finish up with some important reminders, again, just some highlights. The premium did go up slightly this year. The broker commission is still 3% of that premium of $356.95. We were again, for the fourth year in a row, ranked a 4-star or better health plan by CMS. The plan itself offers really an excellent comprehensive medical and prescription coverage. The flexibility to seek services from members, from providers outside of our network. Again, it's a plan that has mirrored benefits both in and out of network. So whatever it is for the in-network, it's the same for the out-of-network. Just seek those Medicare-approved providers. And emergency coverage worldwide is there for them, as well as the financial protection of knowing that max out-of-pocket of $3,400 a year. Again, the Silver Seniors program just keeps getting better. Certainly one that is very well received by the seniors that utilize it. And then take advantage of the discount programs that we have. The vision is obviously one of those. And for folks new, the disease management and care management programs that we have, really try to be proactive, making sure that people are able to understand their critical illness better and be able to manage it effectively. So as you look to the next steps, again, look to the CBIA website for your first direction. The CBIA Medicare tag is where you're going to find the majority of the information that you're going to need. Obviously, the enrollment forms, benefit summaries, things to get you started to be able to enroll people once you've completed the training. And then the link to our website will then provide you with online provider search, the provider directory, as well as the formulary. Claim reimbursement forms are available for both prescription and medical. And certainly with any questions, concerns that you might have, contact CVI sales representative for any additional information. They can always get in touch with me if something escalates or requires immediate attention. But other than that, we'll work towards the question and answer, Max, but I certainly do thank you for your time and patience, and I wish you a successful sales annual election period for 2015. Donna, I don't know if we got any questions that came in. I know one of them that is typical that I touched base on in a couple of little points throughout is how does this differ from our individual plan? And I think, if you were to sit there and put the benefits side by side, you would see some glaring differences that are there for people when they're, really utilizing the plan. And, understand that the prescription benefit is something that is not even available as an individual product on our portfolio. So that is certainly something that's above and beyond. And I think we try to make this plan unique. We didn't want to mirror it to look like our individual because we felt that it was important to have something that helped CBIA be able to deliver something that you can't receive elsewhere. So we do see that there are some major differences. Also that you can live anywhere in the country. Under our current individual plans, you can't do that. So this is a big plus as well. Anything else, Connie?
Well, thanks for restating that, Dave, because that is probably our number one question.